All right, there we are. We are live on Facebook. A little bit early tonight or a little bit late, depending on what side of the country you're on. We are so glad to have you here. I'm Christy with the National EMS Museum. We have our president, Doc here, along with our guest, Todd Stout. We have lots of fun stories to tell. I've gotten a sneak listen to these two talk about the good old days, so I'm excited to hear that. Stick around to the very end. We have some very exciting museum news that we will drop at the end, just like a good teacher will do. They'll make you sit through the whole class. And yeah, I think take it away. I'm excited to listen in here.
Great. Thanks, Christy. Good evening, everybody. Great to see you again, Todd. I don't know when the last time was you and I saw each other face to face. It's been a while.
It's been a while.
Yeah. What I want to do is go back a little bit in your EMS background and the influence that your dad had on you, and then how that morphed into where you are now. So let's go back to the very beginning. You worked in Kansas City, correct?
Yep. I started as a stock boy, driving around an old Cadillac ambulance, picking up backboards at hospitals and washing the blood off in the streets and all of that.
Good infection control stuff, right?
Yeah. It was the old days.
You betcha. I had a conversation with somebody recently when we were doing this stuff with COVID, and I said, crying out loud, when I was first a paramedic, we just grabbed onto the guy's arm and stuck a needle in. There were no gloves, not a whole lot of special stuff. But times they have changed. Yep. So that was in the early 80s then, is that correct?
Yep.
You were in Kansas City?
Exactly. Yep. I was started as a stock boy, was a EMT, paramedic, flight medic on what was the early days of a helicopter program called the Research Eagle, which has since merged with Life Flight. Now it's Life Flight Eagle.
Yeah. And then you went to work for Fourth Party.
Yep.
Tell us what Fourth Party was. I know, but I don't think a lot of other people do.
Yeah, well, first I'll tell you a quick EMS story. Everybody will appreciate as I went down there, or at least EMS oriented. I went to visit my parents in Miami, Florida. My dad and mom lived at a house with a sailboat behind it that they had lived on in the past. And I went to visit them. It was early December, and I left Kansas City, and it was 12 degrees, and it was sleeting and snow and ice, and everybody was wearing their big heavy coats and their gloves and their hats, and they were freezing their butts off. And I landed in Miami, and we walk outside, and everybody was wearing their big heavy coats and their gloves and their hats and freezing their butts off. And it was 59 degrees. And I literally had this epiphany, and I said, I could freeze at 12 with sleet and ice and snow, or I could freeze at 59. And I moved to Miami before the next winter.
Yep.
that just made too much sense. I moved down there. I had lived on the boat that they had lived on for a while. I worked a little bit for Atlantic Ambulance up in Fort Lauderdale and drove back and forth and helped them with their driver instruction program. They'd implemented the Al Davenport fail-safe program that got to be called All Safe for a while. And I had taught that in Kansas City. And did that. And one day my dad said, I kind of need somebody clinical for this job. You're a paramedic. Would you help me out? And so that's what happened. I got in and started helping him with some protocol review and some things like that. And I had never really worked on a computer. So he got a Mac, and I started to do his graphics and clinical stuff. And worked for my dad for a few years, and it definitely changed everything for me.
Yeah, and I think about a year after you started with him is when first time I met him. When I came back to the States from the Caribbean, I met him at one of the state EMS meetings and heard him talk about system status management, and I thought, this makes sense. And I had heard about it before and tried to implement it. And I think I mentioned it to you earlier before we went live, where I tried to do it in the USVI, which was sort of interesting. And So tell me about your time with your dad with Fourth Party. What exactly were you doing in those days?
Great. So dad, his one of his first major, so he actually was in charge of the Arkansas EMS project during the early days of EMS when they had pilot projects in a few places around the country, and the state of Arkansas was one, and he was in charge of that. He had then gone to work for the University of Oklahoma as a research fellow with sponsored by Carnegie Oil at the time, and had a bunch of PhDs working for him. And they did a lot of analysis, and that's where he came up with the idea that at the time was just kind of academic, which was that instead of a bunch of ambulance services and government agencies, or back then a lot of places were still funeral home based services, all running around competing within a community for the business, competing within the market. They came up with the idea of the public utility model that basically said it doesn't make sense to try to have all these fleets and people running around competing. It's kind of like electricity. Back in the old days, they had one electric company that got the franchise for a community to put all the wires and poles in, and like cable companies and things like that. And so they came up with that idea and finished that project. And that was also where some of the roots of system status management, trying to meet supply and demand. But a lot of those concepts kind of came out. And he went back to Arkansas and was working on another project. And Tulsa, Oklahoma had called him and said, "Hey, we're implementing your program." And he said, "Well, what program?" And they told him the University of Oklahoma project. And he said, "Well, that's like an academic idea. That's not ready to be implemented." And they said, "Well, do you want to help implement it?" And he said, "Well, I'm busy." And they said, "Well, we're going to implement it. Do you want to help or not?" And so he came over, and that ended up being EMSA, the creation of EMSA. And that was the first public utility model. So by the time I came in, he had put the EMSA system in, the Kansas City system in place. Fort Wayne, Kansas City was MAST, where I ended up working later. Fort Wayne, Indiana, Three Rivers Ambulance Authority. And when I came in, he was working on finishing up the MedStar system in Fort Worth and just starting on the Pinellas County SunStar system. So I went around with him. Sometimes I was a lot of my work was clinical. My dad was a genius. And that sometimes comes with other factors around that. So I often just was the person to get him to the airport because those were details that didn't necessarily come into play. Sometimes I felt like Ronald Reagan's press secretary. If you remember Ronald Reagan, he would just say all these things that he believed and felt, and then after he was done, his press secretary would come around after and say, "Well, what Mr. Reagan meant to say was this." And when he said this person was an idiot, he didn't really mean they were an idiot. And that was a lot. My dad was very outspoken, and so I just learned a ton. But so I helped him, again, a lot of clinical work, and just learned a lot about system design. I think the thing he was best at was thinking about things as an ecosystem and how it all fit together. Yeah. And he taught me and a lot of other people that if you build a system that provides incentives for agencies and people to do the right thing, then they'll continue to do the right thing. Whereas a lot of systems were designed so that there were incentives to do the wrong thing, and then a whole bunch of rules in place to keep them doing the right thing. And just people always find loopholes.
Were you working with him when he was working with MedStar at all?
Yeah, towards a lot of his projects would overlap. Yeah. And so I was in MedStar kind of towards the end of his involvement there, and then the beginning, and throughout the most of the Pinellas County work.
I don't know if they're still back on my shelf, but I used to have the MedStar protocols and their policy and procedure manual, and I used to hold that up as a model of one of the best sets of policy and procedures and protocols I had ever seen anywhere up till that time.
That's great.
It was really solid stuff.
Yeah,
I used to share it with paramedic students and other EMS system managers, and I said, "Hey, look at this. Look at how they do this."
Yeah, and it was really, what he was good at was coming up with the system design to achieve their results, and it always, always had the sort of end result of patient care in mind. And although a lot of people implemented system status management wrong, he also always had the crews and controllers in the dispatch center in mind as well. But then people would go to some of our system status management classes, and very powerful stuff, and they would come away and it'd be like using a sledgehammer, and they would just move people around like crazy. And so system status management got kind of a bad name. And to this day, I'll still pull out a 1984 sheet of the purposes of your system status plan, and productivity and response times are 2 of 27 purposes.
Right.
And some of them were improve employee morale, improve geographic coverage, reduce post-to-post moves, things like that. But that makes it harder.
Well, and you mentioned earlier, and I'm really grateful for this. I think it's going to be great for the museum that you're going to want us to share some of your dad's works and make them publicly available, and we'll be thrilled to do that, because we've recently gone through the process of getting, I guess, damn near all of the GEMS and EMS magazines, and we're in the process of digitizing all of those. And what we hope with the museum is to become a central source of people doing research. And your dad's stuff would be great to add to that. So why don't you expand a little bit on that, what you think we should be doing?
Yeah, thank you. No, I really appreciate that, and I'm super glad that you're digitizing. I've been a big supporter of that. I'm glad Tom Dick found a good home for his work. All those collections of magazines, and a lot of my dad's work was ahead of its time in many ways. I can go back to things from the late 80s where they're describing community paramedicine, mobile integrated healthcare, describing how reimbursement needed to be different for rural America than other places. Promulgating the idea that you should pay more for high quality and less for crap, and care wherever it occurred, not just transport. All these kind of things that are coming around. So part of what I'm super excited about is to actually pull some of those excerpts out. I still get calls at least monthly from someone trying to find about something, and somebody refer them to them. And I've got most of his work on a website that John Washko helped me set up at jackstout.com, but it's a scanned copy of a copy of those things. It's not good enough to do the optical character recognition, so you can't really search for stuff. So I'm super excited that the museum has taken that on, and I think there's just so much that is astonishingly applicable today. And I don't know if that's a good thing or a bad thing. I remember somebody was talking when my dad got a J. Fitch was kind enough to give my dad a Lifetime Achievement Award. And somebody made the comment that, I forget how he said it. And they said, you're just so focused on response times, Mr. Stout. And we know response times don't matter as much. And he looked at him and he said, well, first of all, we had an Apple IIe, so computing and measuring stuff was hard. So, and response times were easy to measure, and it was a place to start. And we did put clinical quality first, but it was hard to measure it because that wasn't electronic. But he said, I don't know why the hell you're mad at me that I thought of something 35 years ago and y'all haven't done any better since then. He's like, I'm retired. If you folks couldn't take that and do more with it after that, don't blame me. And I just started cracking up, and that was definitely that spot. I've had a lot of conversations with him about EMS today, where it's going, and he was happy and proud of us all.
Yeah.
That we're making progress, but he could get feisty if somebody was giving him crap.
So you went from working with your dad through the EMSA in California, and then to Life Fleet in Ohio. If I've got this all right.
So
somewhere in that
EMSA
area.
was the EMSA in Oklahoma.
Yeah.
Yeah, and
Well, you
and
were
so
at the
then-
you were at the Oklahoma EMSA
Yep.
operation. Okay.
Yeah. I was Steve Williamson was my boss, and I
Yeah.
ran. I was in charge of the public utility model, the authority side within on the Oklahoma City side. I've been blessed to work with amazing people in my career, and those folks in Kansas City and Oklahoma City and Tulsa with EMSA were just rock stars, and I learned so much, and still friends to this day. Then I went to go work for Life Fleet at their corporate offices out in California.
Mhm.
And they were kind of a precursor to AMR. At the time, we were the biggest corporate ambulance organization, and they needed some EMS people. So I went to work for Glenn Leland out there and learned a ton more. And eventually we went around, we helped with RFPs, helped with troubleshooting and system status management, and just generally trying to make things better. And Life Fleet sold to a company called Caroline that became AMR eventually. And it wasn't a great fit. I'm enough like my dad. I'm a little mouthy, and I'm not necessarily the best employee. And so instead of taking me on, I went to go work with Chris Maloney at Tritech Software Systems, a CAD company in San Diego, and that was my way of sort of staying in EMS, but on the technology side, which I had gotten good at working with Steve Williamson in Oklahoma.
And from there,
so I worked at Tritech for about 3 or so years. I ended up marrying one of Chris's sisters. We were married for about 20 years. Wonderful woman. Had my kids with her, Amy, but working for your brother-in-law is not the easiest thing. As I found out, working with my dad after a while wasn't either. But Chris and I have remained friends for years. So I went out and started my own business. A fellow named Ben Hinson out of Georgia gave me the name for. He called me up one day when I was at Tritech, and he said, "If you ever start your own company, you got to call it Stout Solutions." I'm like, "That's pretty good." And when I went out on my own, I couldn't think of a better name than Stout Solutions. So I started Stout Solutions and did reports for Tritech customers and Dr. Clausen's ProQA customers. And one of my first customers was Kansas City, Missouri Mast, where I had.
Let's go back a minute. Wait a minute.
Yeah.
Slow down. You
Yeah.
mentioned Jeff Clausen.
Yep.
What was the fit between you and Jeff?
Well, my dad and Jeff were writing in GEMS at around the same time.
Yep.
And my dad, at the last time he was at Pinnacle, he died in July, but about a year before that, or so, year and a half before that, he was at Pinnacle, just visiting with people, and he said we couldn't have done my systems if we didn't have Jeff Clausen and the priority dispatch system, because the whole idea of matching supply and demand is to be able to figure out what you're responding to in a reliable way. So I know where to send the closest ambulance, which call to send it to if I have to choose. And so he and Jeff Clausen were sort of promoting these crazy ideas at the same time. Jim Page and Keith Griffiths, who were running GEMS, kind of had both of them in their stable of writers, so to speak, that would contribute. And so I got to hang out with Jeff Clausen and at a pretty young age as well. So and that data is, from a data perspective, is some of the only real clean data we have in EMS, because it's very coded. And Jeff has always said, we're going to get to the same path with the same questions and end up with the same code. It shouldn't matter if you're in Kansas City or if you're in Fort Worth or anywhere. So I wrote reports and did that and really help people use their data to make decisions. You know, I used to say when I was running Oklahoma City, I was young and probably there well before I had any right to be in that position. And I didn't have a gut or a gut feel. So I got good at getting the data out to kind of look at it. And so I use that experience to help people think about what to do and use that information to do the best they could.
So I look at your history and I see a continual upward evolution of understanding how EMS ought to work better. Problem-oriented dispatching from Jeff, for example. I mean, that was just a novel concept that everybody did not grab onto real fast at all.
Yep.
But it made all the sense in the world. Send the right unit to the right problem and patients are going to do better.
Yep.
And the other thing that's interesting, because I'm still involved with critical incident stress management, and you mentioned employee morale as being one of those 27 points of what your dad went after. It's amazing how good employees feel if they've done the right thing for the right people, as opposed to stuff going south.
Yep.
So you come through that series of transitions from TriTech, and then you started Stout Solutions, which then became FirstWatch. Tell me more about what FirstWatch does.
So it's a great question. So everybody's got, computer-aided dispatch. Some of them have emergency medical dispatch like ProQA. These days, almost everybody has electronic patient care records. And there's all these systems that are geared towards, assigning the right unit, tracking the right unit, and the data underneath the covers is complex and often dirty because, we can't. It's not like,
there we are.
It's not like you're doing, accounting or other kind of software. It's, we got to get the call done and get to the next call. So it's not going to be perfect. The electronic patient care record. I know, when I worked as a medic in the field, we were still on paper and, I didn't ever feel like I was there to do great paperwork. I thought I was there to take care of my patient and paperwork was a necessary evil. So the data's dirty. People are getting things done. And so what we do is, and we started out in Kansas City during the old biosurveillance, right? Actually, before 9/11, Dr. Rex Archer, who was the health department director in Kansas City, had wanted to monitor their dispatch data for trends that could indicate a weapon of mass destruction. And frankly, he said, he told my contact, a really nice guy named Jim Jones, he told Jim, he said, New York City's getting ready to do this and I want to beat them. And so Jim called me and he said, you got any idea how to do this? And I said, well, we can figure it out. And I went to the Barnes and Noble and bought some statistics books. And we put this thing together that would watch the CAD data in real time. And it would send out alerts if there was a statistically significant increase in certain kinds of calls that could indicate a weapon of mass destruction. And that just sat there and cranked away. And then 9/11 hit. And then anthrax letters were sent out, including to down to your neck of the woods. And it began to become a thing. And actually, I had been at TriTech and saw how hard it was to run a real software company. And I didn't realize till I worked for one that it's every bit as hard as running an EMS system, just in a different way. And I actually tried to give the idea away to Chris Maloney at TriTech. I tried to give the idea to Dr. Clausen, and they all thought it was cool, but not enough to take on the work. So what we do now is we look at all that data in as close to real time as we can. We bring it in and we sit on top of it, and then we make it useful. So we're kind of like a framework that we apply to people's problems. And if you're in the FirstWatch network and you say, hey, I need to work on, like right now, hospital delays with COVID are huge in a lot of parts of the country. Need to work on hospital delays. What do you got? And then we can show them how we help provide data to people to improve their hospital delays, to share the information so they can get hospitals to pay attention to what they're doing. And you can kind of apply best practices that data sharing. And we've been really lucky. We've worked real hard. We're now, our customers cover about 47% of the population of the US and about 20% of the population in Canada.
Very impressive.
And, you know, it's a very dirty data, very high touch. You know, reports are easy to write. Reports that people like and are accurate are hard to write. And so it's not really software. It's really this system that we apply. And we help people with everything from, you know, looking at response times to making sure people got meal breaks, to making sure that, you know, which crew do I pick that is the least busy for a call if I can choose that, and watch for fatigue. We do quality improvement. We'll actually mine the data, including the free text of the electronic patient care record, and see how what the medic documented compares to the protocols. And you take a system, you know, one of our customers is New York City. And they really almost couldn't put enough people in place to look at every record.
Sure.
But before their quality folks take a look at a record, they already know a whole series of questions have been taken care of. And then you can really let the human do the human work and let the computer do the computer work. And the combination, you know, some people even call it kind of almost like an assisted artificial intelligence, assistive artificial intelligence, because we really combine the best of that human and you know, machine type approach and stuff. But, you know, I think why our stuff has gotten so good is really smart customers. You know, about 5% of what you see that we do is stuff we thought of, and 95% is somebody like you going, you know, if you could just do this, that would save me like 10 hours a week.
Yeah.
Like,
yeah.
Let's do that then. Here we go.
Yeah. So have you also worked on improving the EPCR, the electronic patient care records, and the kind of stuff the algorithm drives those?
I think people use some of that. You know, part of what I say sometimes is, a lot of times you got to choose whether it's a CAD system or EPCR system. Sometimes the things that are best and easiest for the medics are crap for getting the data out and do an analysis to try to make actual real system improvements. My buddy Mike Tegman works with us, and it's all about really making real big improvements, not just go beating some medic up for doing something different than they're supposed to.
Yeah.
But, you know, a lot of research shows that, you know, focusing on individual problems doesn't actually has small changes, small improvements. Focusing on system problems has big improvements. So, you know, so we can kind of, and I've talked to a few people that, especially with the economy now, they can't afford to switch their EPCR system. But a lot of why they were switching was they just couldn't get any data out of it. And so we can make that last longer. I think, you know, people's tolerance in public safety used to be high. You know, I still have customers that are just now getting out of COBOL CAD systems. And there was just sort of this expectation that it's public safety and we'll just suck it up. But, you know, as old farts like us are moving out, and the youngsters are coming in that are used to using computers and frankly used to not tolerating nonsense. They're pushing the demand for change, and user interfaces are super important. Flexibility is super important. You know, I always, you know, I tell software companies that come into public safety, because they'll come talk to me a lot to just talk about what works and what doesn't work. And so you got to understand, EMS people are people that have chosen to work without direct supervision, because there ain't nobody looking over their shoulder most of the time. They're solving life and death problems in an hour. And that's what they want to do. And they often have really low tolerance for BS. And so you give them bad software, you give them bad equipment, bad whatever else, and they'll break that crap. So you might.
I've never seen that at all. I've never seen that. No. It's
happened to fall out of the rig while we were driving.
Yeah.
But I think that's, in the long run, that's good, because, you know, these things need to change. It needs to get things need to improve and get better. And I think you'll see a lot of changes over the next 10 years or so, especially as things are more cloud-based.
Yep. Yep. I'm going to ask Christy to jump back in. She's hiding in the background quietly. There she comes. Hi there.
Hi.
So you wanted us to get together with you at the end of this because you were going to share some information with us, I believe. Is that correct?
Well, that's true. You kind of stole my thunder, but that's okay. Before we get too far off this subject, though, Todd, I wonder if you have any words of wisdom. We tend to have some families join us, if not for the live broadcast, for the broadcast afterwards. And being in more of the tech sector and kind of a not direct patient care route, do you have any words of advice for the middle schoolers, high schoolers that might be interested in the coding, the cloud-based systems games, and what a career in EMS might look like for them if they're not going to do, ride the back of the truck type thing?
Yeah.
Where should they go to learn about it?
Yeah, for sure. Really great question. So first of all, I feel like a lot of my success in business and in life comes from the fact that I was in the street. When you're in the street, you see people at their best and worst. You see rich people, you see poor people, you see everybody. And I think I learned about, humans, and how to communicate, and that the janitor is just as important or maybe more than the owner. So I think that is a great place to start. And if people don't want to do blood, working in the 911 or communication centers is a great way to feel a lot of the same things. So I think that's a great foundation, no matter what. And then, and so a lot of people stay in there. We're about 65 people at FirstWatch, and almost half our team are from EMS and public safety, because they understand our business, and also because when the phone rings at night, they'll wake up and be functional pretty quick, and then get to go back to sleep.
That's great observation.
Well, there's so many people in the world that just whole waking up in the middle of the night thing is not easy, and waking up and within a few seconds being useful to the world is a real skill. So we're lucky it's good folks. So, and then I think on the technical side, I think almost every job needs some kind of technical, or at least benefits from some kind of technical background these days, or a huge percentage of them do. So I think, getting comfortable with, not necessarily programming. If you're into that, there's a lot of great ways to go through that now. A lot of free online learning stuff. We hired a young fella straight out of a coding boot camp that had gone to do that. His dad had a construction company, and his dad really wanted him to follow along. I met his dad; he's a good man, but he didn't want to do construction, and he kind of defied his family and did this, super intensive 6-week kick your butt coding boot camp thing. And he came in and he said, "I got no experience except in construction and coding boot camp," and presented him well, and presented himself well, was professional and appropriate. And we gave him a shot, and he's butt kicking. So I guess my message about that is trying to figure out how to get good with people, if you can, is really the key. And then what the skills are as you go through it. I think the other thing I would say is that I think a lot of young people assume that it's inevitable that you're going to change jobs every couple years. And there are a whole ton of organizations out there, not necessarily in EMS or public safety software, at least, where they believe in people. And we have people of all ages come into work for us. And, pretty much if people stay a year, they stay forever. And they like it, and we're like family. I read a fantastic book I would recommend to everybody called Everybody Matters: The Extraordinary Power of Taking Care of Your People Like Family. And it's by a guy named Bob Chapman and another fellow, Raj Sisodia, and he runs a Barry Waymiller, which is a now $2 billion worldwide organization. And so it shows that you can be human and take care of your people and be a business. And I think if I were a young person, I would say, learn about people, learn skills in what you like, and find a company that actually cares about you, and stick there.
Excellent.
Excellent. That's wonderful. Just for those that may have missed the early part of the conversation, I am totally stoked to say that the National EMS Museum is going to be partnering with Todd Stout to make the Jack Stout papers accessible to researchers. So part of our big digitization project this year, in conjunction with our 15th anniversary and celebrating 15 years of collecting and saving EMS history, we're trying to digitize as much of our collection as possible. So that has started with the Tom Dick collection, which you've probably all been following that along for the last few months. That's underway, where we have it at a scanner. They're doing optical reading of all the PDFs, so the PDFs should all be searchable. And the next collection we're going to do is Jack Stout's collection. So a big thank you to Todd for kind of joining us in this big, huge adventure. And to you all out in Facebook land and beyond, we're going to need a lot more cash to get this taken care of. We have lots and lots of boxes in the archives, and we are already getting questions about when they're all going to be available. So the more money we have come in, the faster we can do this. And if we could get it all done by the end of the year, that would be so exciting. You can go to emsmuseum.org/support and choose how you wish to support the museum. You can become a member. There's special projects we're doing where you can donate directly there. But right now our focus is going to be this digitization project as well as our ambulance restoration project. So those are the two big things going on in 2021. I asked people to post their questions for you, Todd, on Facebook, and we haven't gotten any, but we've gotten a lot of waves and hi and good to see you. So we just want to say thank you on behalf of our visitors for joining us this evening. And thank you for allowing us an access to your experiences and your dad's experiences. I've already messaged Sarah. We are going to get on your calendar pretty quick here. And you can visit emsmuseum.org/virtual museum, I think it is, and access our digital archives. They're going to start rolling out pretty soon here now that we have the landing page built. So keep checking back there. And thank you, UK Rob. We are a 501c3, so any donation is tax deductible to the museum. So wink out to our friend Rob, who always reminds me to say that bit to get the most out of our donations. So if there are final words, shout them out. I want to thank you both for a wonderful Friday evening. This was a great way to end the week.
And we'll be back again tomorrow night with Keith Wages.
Great. All right. You guys keep my head on straight. Thank you so much.
Thank you.
Thanks.
Appreciate the opportunity.
Thanks, Todd. Good to see you, buddy.
Thank you. Thank you both. Have a great night,
everybody.
everybody.